Welcome, everyone. I am glad to have you here today and to have our guest here today, Dr. Nader Hijazi from the Abdali Hospital in Amman. Dr. Hijazi is a doctor of pulmonary critical care and sleep medicine and is here with us today to share with us a data dashboard that could be quite useful here for the region in particular. So without further ado, Dr. Hijazi, please tell us a little bit about this work that you've done and what you've put together.
Thank you so much, Peter, and thank you for inviting me. And so basically, in the last few weeks, when I was looking at, what's going on around the world, and we see a lot of data from, specifically for different countries, but we don't have a lot of local data. So this is how it kind of started.
Wonderful. Why don't we go ahead and take a look? Let's see.
So this contains some basic local statistics.
And so these numbers that you're showing us are specific to Jordan.
Correct.
Wonderful. Wonderful. Tell us more, please.
Okay, so this is basically the map, and it shows you the distribution of cases. And if you hover on any of these bubbles, the bubbles size is proportional to the number of cases. This will give you the number of cases and the population. And so you can get a visual of where these cases are distributed, for example. And the second thing, and this is a very important, and this actually was the first graph that I wanted to create, which is the growth factor. Now, when we're talking about anything that grows exponentially, the most important number to look at is the growth factor. And I can maybe elaborate a little bit on that.
What is the growth factor? Tell us what that number means.
Okay, so when we're talking about exponential growth, we're talking about either multiplication or division. So the number, either it's being multiplied every day by a certain number, as opposed to a linear growth where you add or subtract. So if you want to assess whether the spread or it's accelerating or decelerating, you look at the growth rate.
So tell us more. What else do we have on the other?
Okay, so on this page, there are many statistics. These are one of the two important ones, is the doubling time. So when we're talking about exponential growth, you want to know what the doubling time is. That will tell you how fast it's growing.
And what's on the third page?
Okay, so this is more a simplified web page. We're trying to put like the different regional countries, or like the Arab countries, the Arab world, and just to kind of show different statistics of where we are. This is the total number of cases and deaths, and this is kind of a visualization of the different countries. And of course, you can scroll up and down on this. You can maximize it to show it clearer. So this kind of shows where we are compared to other countries. So this is kind of a basic one. And the last one is a very simple one for the rest of the world. It just shows you the total cases and percentages and some simple graphs. The main purpose for this web page was to look at local statistics.
Yes, Dr. Hijazi, please tell us a little bit about how you gathered this data and
absolutely
add that into this.
Okay, so the number one most important thing is you always, when you present cases, you have to be credible. You have to make sure that all the numbers are accurate. You don't want to spread inaccurate information. So for Jordan, for example, we use some of the world-renowned places. Like we're actually using the European CDC, which is similar to the WHO and the Johns Hopkins data, just for the total numbers. Now, the distribution, by the way, this was really hard and painstaking. Like, we actually went through every single video that the Minister of Health released and tried to look at the distribution of cases, because it's not, easily available of where these cases are. And we look at these cases every single day and we update them. So this is something that, we try to gather ourselves.
So the information of cases in Jordan came from reading every single report or watching every video from the Ministry of Health about which cities were surfacing cases of the virus. And I think we've heard recent reports in the last few days about how areas like Aqaba, for example, and Madaba are regions where there appear to be 0 cases.
Exactly.
This helps visualize that and show that. Well, Dr. Hijazi, thank you so much for sharing this, and thank you for the work that you've done to pull this together and for the work of your colleagues who have supported you at the Abdali Hospital. This is a challenging time for everyone in the world, and I think especially for you as a pulmonologist, there must be some academic interest in it as well. Um, and I know I can speak for myself in any event to say that I'm grateful to be able to have a resource like this, similar to other resources that we've seen trying to share local information, but this is much more detailed. So thank you so much. Really appreciate it,
Oh,
and your other contributions to the symposium as well.
no, thank you so much. Stay home and stay safe. I guess that's the message. And let's flatten the curve. We're doing well, so let's keep doing it.
Indeed, indeed. Inshallah.
Inshallah.
All right. Talk with you again soon. Bye.
Thank you so much. Thank you.